My name is Dr. Nick Holekamp. I'm the Chief Medical Officer at Ranken Jordan. Thank you very much. I've been there about 15 years now. I can't believe it, but I'm really glad you're here tonight. Welcome, and thanks for being here. And I wear quite a number of different hats at Ranken Jordan. And one of my jobs is to convince people that supporting the hospital is a good investment. I'm not a businessman, but we are running a hospital, but we're also running a business. And I obviously think it's a good investment. I may be a little biased, but I believe there is real and unique value in what we do. But how do you measure value? What's it worth for a child to spend time at Ranken Jordan? I'm not talking about the cost of care. I think it's more to do with what we value as individuals and as a society. Certainly I can make a strong case for why Ranken Jordan provides value to the healthcare system locally and regionally by providing better care, excellent outcomes, and lower costs. That's the triple aim. That's the holy grail of healthcare reform for those in the know, and we nailed it. And we do this for the sickest 1% of kids who use up to 40% of the pediatric healthcare dollars. But even that's not really what I'm talking about. So in a few minutes, you're going to meet Tracy, who's here tonight, and who's actually very lucky to be here at all. We're going to introduce him in a little bit. He miraculously survived a horrifying accident and then spent the next 6 months in 5 different hospitals. But I'm going to let him and through the video and his family tell you how rocky his road home would have been without Ranken Jordan. Before that, I want to tell you a little bit about another patient. His name is Andrea. I don't know if you can see pictures of Andrea yet or not. Andrea's journey was a little bit different. She was born with a very bad heart. She needed open heart surgery and really the most advanced medical care available just to get her through the newborn period. Unfortunately, she had lots of complications. Along the way, she had one problem after another, and by the time she was a year old, 3 major organs were damaged beyond repair. She needed a breathing tube and a ventilator. She needed dialysis for a time. She needed daily labs and IV medications and artificial feedings. When she first got to us, she was one of the sickest little girls we've ever taken care of. And frankly, nobody really expected her to survive. She wasn't going to get a new heart. She wasn't going to get a kidney transplant or new lungs. She couldn't go home. But solitary confinement in the ICU just didn't seem to make sense either. So she came to Ranken Jordan. Altogether, Andrea spent more than a year with us. And while she was there, she actually, for the first time, had a life. She had friends to play with. She had great medical care. That sort of goes without saying, if I do say so myself. But more importantly, I can't help it. She got out of her bed. She got out of her room. She got to play spaces inside and out and therapy spaces. Despite being totally dependent on machines 24 hours a day, she was treated like a kid, not like the impossibly sick intensive care patient she was. As you can tell, I hope you're seeing good pictures, her family loved her very much. They'd ridden this roller coaster ride with her. They'd been told a dozen times that she wouldn't survive, hearing that month after month, and yet there she was, smiling and playing. At Ranken Jordan, for the first time, her parents got to experience the real Andrea, their beautiful little girl, alive and loving, and not just existing. And they were able to enjoy the quality of their days together as much as the number. She fought very hard. She was very brave. But gradually, her parents came to understand that her journey would be shorter than they had hoped. There would be no more scary ambulance rides back to the ICU, no more operations, no more painful procedures. Ultimately, they wanted to let her stay where they felt that she was the most comfortable and the most loved, among her family and friends at Ranken Jordan. Just before her 3rd birthday, when her kidneys finally shut down completely and her lungs filled with fluid, they held her close and said goodbye while her Ranken Jordan family took care of everything else. No one can put a value on what that meant to Andrea and to her family. It was invaluable. And that's why you all are here tonight. That's what we're asking you to be a part of, to support and to invest in. An invaluable asset to kids and families in our community and from around the country who wouldn't in a million years choose to be at a place like Ranken Jordan. But thank goodness we're here when they do. Thank you for helping make it possible for us to be there for kids like Andrea, for kids like Tracy, and Dylan, and Mikey, and Abby, and Molly, and Candace, and hundreds of other kids we take care of every year who all have crazy, sometimes sad, inspiring, and amazing journeys, all in different ways. They need us to be here. Thank you for investing in them. You're going to see the video, and I really hope you enjoy it, and then we'll introduce you to Tracy. And again, thank you for being here tonight.